Okay, good afternoon. I'm Mr. Mamba. So today I'll be teaching how to do Glascow Coma scale. So GCS scale. So this chart is the one that is used to check the levels of consciousness in a patient. So this chart has got three parameters. There is eye opening. So eye opening, best verbal response, best motor response. So under eye opening, there are 5 things that are there. So there's spontaneous opening, there's to speech, to pen, and none. Then best verbal response is oriented, confused, inappropriate words, incomprehensible sound. Then under motor response, there's obey command, localize pen, withdraw from stimuli, abnormal flexion, abnormal extension, then there's none. So Glasgow Coma scale, it is always out of 15. So the lowest that a patient can get when a patient is in a coma state, it is 3. So the patient can't get less than 3 because at each stage, if the patient has not responded, you give a 1, which is none. So under eye opening, if the patient has not opened the eyes, you're going to give that patient 1. Best verbal response, if the patient has not responded, the patient is quiet, you're going to give that patient a 1. Under motor response, you tell the patient to lift the left hand, the leg, or any part of the body, and the patient does not obey. You try to introduce pen, the patient fails to localize the pen, you're going to give the patient a 1 if the patient is not responding. Okay, so I'll start doing the procedure. Make sure to follow and ask questions where it is not going to be clear. So the first thing during OSCE, so I'm doing it OSCE standard in case you're asked to do it during OSCE. This is what you're supposed to do. First, make sure wash your hands. When you're told start performing, wash your hands. After washing your hands, you go on the chart, indicate the name for the patient, file number, the ward, the date, time of admission, date of admission, and also you can indicate the age and sex of the patient. After you've indicated that, all those things are supposed to be indicated on this file. Minus indicating those things, you end up losing marks. So on the checklist that the examiner will be having there, it will be showing that has this student indicated the name? So all those things shouldn't be omitted during OSCE. After you've indicated everything that I've stated, now you can go ahead and start the procedure. You can continue with the procedure. So I've indicated everything. After indicating everything, the name, the file number, the sex, the age, diagnosis, time of admission, and date of admission. Then I'll start now assessing the patient. So the first, it is eye opening. So under eye opening, upon reaching here on the patient, if you find that the eyes are open, it means you're going to give or score the patient 4 under eye opening. So the way we count, so we start from down here, 1, 2, 3, 4. So if the patient has opened eyes, we're going to give the patient 4. If the patient has not opened eyes spontaneously, I'm going to ask the patient a question, or I'll call the patient. If the patient opens the eyes after I call the name or I talk to the patient, I'll give the patient 3. I'll score the patient 3. So I'll call the patient. So as well, okay, so as well has opened his eyes after calling his name. After I mentioned his name, he opened his eyes. So I'll give him a 3 out of 4. So here, eye opening, it's out of 4. Then this one out of 5, 6. When we add these, it is 15. The total is 15. So if this one has got 3 under eye opening, meaning I won't continue, I won't introduce pen or any stimuli. I'll go to the next which is best verbal response. Under best verbal response, during OSCE, just ask the question to the patient. Ask the patient to say, where are you? Or ask the patient the time. So we expect the patient to be oriented. If the patient is oriented, you give the patient 5. As well, where are you?
I'm in the market.
So as well is not oriented, he's confused. He's not aware of where he is. He thinks he's somewhere else at the market. So you're going to give the patient, you score the patient, you start counting from down here, 1, 2, 3, 4. So under confused, which is 5. So the patient is confused. So 5. Then it means you won't continue with best verbal response. It means it's done. So it's 5. Then you go to motor response. So under motor response, you ask the patient to lift the leg, or you can tell the patient to lift the right hand or the left hand. So the patient, if the patient is able to do that, obey command, the patient will obey command. As well, kindly lift your left hand. So the patient is is able to obey command. So under best motor response, the patient has obeyed command. So you're going to give the patient 6. After you've given 6, so you can add 6 plus 5 plus 4, and here there's 3. So 6 plus 5 plus 3, which is 13. Then there are these dots here. So I'm supposed to check the pupil size using a torch. So what you do, okay, so you check the pupil size. So according to what I've checked, the pupil size here, it is 3. So I'll indicate a 3 here. Then during OSCE, in case the patient, the face is swollen and eye opening, don't forget to indicate a C. If the patient has got any tracheostomy, don't forget to indicate a T. So the total that you get when you add these numbers, you're supposed to indicate a T over 15. So indicate the total number. I'll give an example. Maybe the patient has got 7 out of 15. You put 7 out of 15 with a T. So it will show that the patient is has got a tracheostomy. Okay, so that's all. Thank you very much. If there are questions, you can ask those questions and I'll respond.